The foregut is the part of the gastrointestinal tract that extends from the mouth down to the second part of the duodenum. And that's where the pancreas and the biliary tree joins the small bowel. The foregut consists of the esophagus, stomach, the duodenum, the pancreas, and the liver and biliary tree. Esophageal diseases can be divided either into benign diseases or malignant diseases. The benign diseases range from people who have difficulty swallowing, like what we call dysphagia, which can result from a few conditions. One of them is having a stricture that can result from severe or prolonged reflux disease. Another reason for having difficulty swallowing is having what's called paraesophageal hernia, and that's basically when the stomach herniates through the diaphragm from the abdomen, the belly, up to the chest. So sometimes when the stomach gets up there, it can push on the esophagus, making swallowing a little bit difficult. In both scenarios, where patients have a stricture or they have a paraesophageal hernia, they might also have the symptoms called gastroesophageal reflux disease. What happens with the reflux disease, the esophagus is not usually created to withhold acidic environment. So with the reflux disease, sometimes the esophagus can get some inflammation, which ends up in a stricture, which we call a peptic stricture. And that can lead to difficulty swallowing. Also, in some conditions, for some congenital problems, sometimes people can have weakening of their esophageal hiatus, which is basically the opening that allows the esophagus to pass from the chest to the belly. Sometimes there can be a weakening and widening of that area, which leads to what we call a hiatal hernia. These patients are diagnosed endoscopically, where a camera goes down the patient's esophagus, looking into the stomach, and the condition can be diagnosed. In both of these conditions, usually patients are treated initially medically, where we give them some antacid, whether it's Protonix or some antihistamine. Once the extensive workup is done, the patient can be offered minimally invasive hiatal hernia repair, and basically what it entails, pulling the stomach back from the chest down to the belly, and we create what we call a fundoplication. Basically, what that entails is that we augment the upper part of the stomach to prevent acid from refluxing from the stomach up to the esophagus again. And that solves the patient's problem.